And our next speakers will speak to some of those issues because they've seen patients and the problems that they have. Our next speakers are Melinda Myers and Jo Meggers, who have been healthcare professionals for many years and are currently registered nurses at the University of Iowa hospitals and clinics. We'll start with Melinda.
Thank you, Dr. Thomas. Sorry about that. We must fix America's broken healthcare system. This is the year we cannot afford to wait. Crushing healthcare costs have made it impossible for many families and businesses, small and large, to make ends meet. This is the year we can guarantee everyone access to quality and affordable healthcare. Every day I'm faced with the reality of our broken healthcare system. I'm a nurse at the University of Iowa hospitals and clinics. The University of Iowa is the major provider for those who cannot afford healthcare in Eastern Iowa. One of the hardest things to see as a nurse is someone who has put off seeking care simply because they didn't have the money to pay for it. It is then we see a simple condition balloon into an extremely costly hospital stay and possibly long-term effects to the patient's health. We see this more and more as Iowans continue to lose their jobs and their health insurance with it. At work, one night, a patient was admitted to my unit with a brain abscess. His story in report was that he had a cold. It turned into a sinus infection. He knew he needed to see a doctor, but he didn't because he didn't have insurance. So he thought he could ride it out. And he knew it would cost him a lot of money if he went to the doctor. So he wrote it out and had a fever with severe headaches until finally he couldn't take it anymore and he came to the emergency department where I work. He had brain surgery to drain the abscess. So instead of having a $100 doctor visit with maybe a $100 prescription antibiotic, he ended up with about 20 times the bill for a sinus infection. There is a social worker that I work with named Stephen Cummings. He's a surgical ICU social worker and works in other units as well. He states that the recurring issue are patients with no insurance who are harmed in accidents, who don't qualify for federal insurance called TXIX because they aren't injured enough. Their injuries aren't extensive enough. They linger in the medical system and basically recovering in our hospital for a long time, unable to access appropriate rehabilitation because they lack insurance of their own and don't qualify for the larger program called TXIX. Stephen also states, one of the biggest issues I see is when a patient does not have insurance, often a rehabilitation or a skilled facility will be able to work with the patient, but that entity will be a great distance from the patient's family or that patient's community. So we send patients to willing facilities in Illinois, where currently there are skilled care facilities with on-site dialysis and other amenities, even though patients are from Des Moines or even farther than that. These types of cases occur all across the country. With our current rate of unemployment, every day 14,000 more Americans lose their health insurance every single day. That is why it is so important for Congress to pass health care reform now, this year. It's the only way to lower overall healthcare costs and ensure quality, affordable healthcare for all. This is National Nurses and Healthcare Professionals Week, and SEIU nurses across America are calling a code on healthcare. Just 70 SEIU nurses across Iowa, Service Employees International Union, employee nurses across Iowa reached out to Senator Grassley, urging him to support comprehensive health care reform and help pass a bill this year. Thank you.
My name is Jo Meggers. I'm so glad to be here with all of you today and with my fellow speakers. It's an important thing that we're here for. And I was one of those nurses who called Senator Grassley's office yesterday. I explained to his staff that an overhaul of our healthcare system needs to pass through Congress as soon as possible. There are a number of ideas out there on how to expand quality insurance coverage to more Americans. Many of those ideas were fleshed out in the Senate's coverage roundtable on Tuesday. Nurses at SEIU believe that there are 3 basic principles of reform that must be met to ensure that all Americans have access to a quality plan. The first principle is, of course, affordability. In 2004, half of all people filing for bankruptcy cited medical costs as a reason, and they lost their homes. In 2008, half of all home foreclosures were due in part to the high cost of coverage and care. These statistics are alarming, and these situations could be avoided if people could simply afford quality coverage. The next principle, and easily the most essential to revamping our broken system, is creating a public health insurance option. The option of a public health insurance plan is necessary to ensure appropriate and adequate coverage, to foster choice and competition, to bring down costs, and to assure consumers have a stable marketplace where they can find quality, affordable coverage. Our elected leaders in DC need to deliver the change Americans voted for when President Obama promised to let everyone buy into the same type of insurance members of Congress receive. The last principle that will help assure greater access to coverage is employer responsibility. Business, government, and individuals must come together and share responsibility in solving Americans' healthcare crisis. If we can build on the employer-based system, it will help people hold onto their employer-provided plan if it works for them and their families. And I remember as a youngster that all the companies, it seemed like if you went to work for a company that you had healthcare coverage, it seemed like all the companies, it was just something that was done. I remember when I first started my job working in one of the factories in Iowa City, that people who were employed by that factory, that no matter how large their family was, and some of them from local communities had 8, 9, and 10 kids, that under their healthcare program, their whole family was covered, and there was no questions about it. And I think it was at no cost to the employee at that time. And I know that with the situation in healthcare, that healthcare now is so complicated, and you know, that it's at such a level where so technical and everything, and for that, the cost of our healthcare has gone up tremendously. It's a lot better healthcare, but it is still more costly. So it all comes down to affordability. A public health insurance plan must be affordable for those who've been priced out of the market by private insurance. And when employers do right by their workers and offer health coverage, they need to be able to stay competitive with businesses across the country. These basic principles are essential to securing a truly American solution to health care. We are so close to finally making health care reform a reality, but we need to keep the pressure on Congress to do the right thing. I urge you all to stay active in this issue, do as we've done, and reach out to your federal elected officials. Let them know that 2009 is the year to fix our health care system. Thank you.
I am vertically challenged, so I have to bring this back. I never thought it was fair when I was in residency at the university that we could give hormones to young women to stop them from growing taller. But at that time, we couldn't give them growth hormone to make people like me taller. There's some research to be done here.
I think I'll stick to my current view.
Well, that helped me too, so we're fine. I do want to thank all the speakers for coming and sharing their expertise and their experience in the field of healthcare. At this